Mr. President, I rise today to recognize February as National Children's Dental Health Month. Every year since 1981, we have acknowledged the importance of children's dental health and worked to ensure that all children have access to proper oral health. As former U.S. Surgeon General C. Everett Koop reminded us, there is no health without oral health. Today, tooth decay is the single most common chronic childhood disease, 5 times more common than asthma, 4 times more common than early childhood obesity, and 20 times more common than diabetes. Despite the fact that tooth decay can be prevented, nearly half of all 5-year-olds have experienced tooth decay. Left untreated, tooth decay can not only destroy a child's teeth and health, but also have a severe negative impact on a child's quality of life. Because children with severe tooth decay are frequently in constant pain, they are often unable to learn, play, or interact with others. Recent studies have shown that children with poor oral health are nearly 3 times more likely to miss school due to dental pain, and children reporting recent toothaches are 4 times more likely to have lower grade point averages than peers without dental pain. Good oral health is essential for our children to thrive. It is simply unacceptable that 16.5 million children are denied basic dental care each year. The health and well-being of every child depends upon access to affordable care for all of his or her health needs, including dental services. Tooth decay and oral health problems also disproportionately affect children from low-income families and minorities. According to the National Institute of Health, about 80% of dental disease in children is concentrated in 25% of the population. And children from poor families face an inordinately high barrier in receiving dental care. To these children, the consequences of poor health care can be devastating. Many have heard me speak before, including on the floor of the Senate, about the tragic loss of DeMonte Driver, a 12-year-old Prince George County resident who died in February of 2007. DeMonte's death was particularly traumatic because it was entirely preventable. It's outrageous that only a few years ago, a young boy died in our country because his family was unable to find a dentist to remove an infected tooth. By the time he was evaluated at Children's Hospital emergency room, the infection had spread to DeMonte's brain. After multiple surgeries and lengthy hospital stays, he passed away. Mr. President, this was a tragic loss of life that was completely preventable and a waste of terrible resources, a person's life and hundreds of thousands of dollars, when all it took was an $80 in dental care to save his life. I recently heard another story which gives me both hope for the future and strength and resolve to guarantee that all Americans have access to proper dental care. Ronald shared his story at a 2-day Mission of Mercy Health Equity Festival at the University of Maryland, where he waited 15 hours at a charity clinic to have a tooth pulled that had been troubling him for 2 years. Prior to the charity clinic, Ronald had been living with 2 choices: endure increasingly worse pain or go into debt for dental care. A working man, Ronald had spent $800, his entire savings, to get a tooth fixed in 2012, but it continued to bother him. Recently, he paid a different dentist another $795, his rent money, for relief. The dentist suggested a more expensive procedure, but Ronald was unable to pay the high costs. So it was just a Band-Aid, he said. Now he's behind with his landlord trying to catch up. Ronald talked, however, with great pride about his 9-year-old soccer-playing daughter, who weighs away candy and drinks water instead of soda. I didn't know about oral health when I was her age, he said. Like many other children in Maryland, Ronald's daughter has access to dental care through her state's Children's Health Insurance Program. She has coverage for pediatric dental, and she learns about oral health in her schools, and she's taking steps to make sure that she has proper oral health and she has coverage if she needs to see a dentist. Thanks to CHIP, we now have the highest number in the history of children who are insured with medical and dental insurance. CHIP provides affordable, comprehensive health care to more than 8 million children from working families. People earn too much to qualify for Medicaid, but cannot afford private insurance. CHIP also provides funding for school-based health centers that are critical to providing dental services to at-risk children. I have visited these schools and have seen firsthand how effective they are in delivering dental care to our children. However, if Congress does not act to reauthorize funding for CHIP before September 30th, the program funding will run out and millions of children will again be at risk. I'm very proud that my state of Maryland has been recognized as a national leader in pediatric dental health. In the 2010 Pew Center report on the state of children's dental health, Maryland earned an A and was the only state to meet 7 of the 8 policy benchmarks for addressing children's dental health needs. In addition, in the Maryland Health Benefit Exchange, every plan except one includes pediatric dental coverage as part of the comprehensive medical plan, so families don't have to pay a separate premium for pediatric dental coverage, and they don't have to have an additional out-of-pocket cost. In the Affordable Care Act, we included pediatric dental as part of the essential benefits, so therefore every family has access now to affordable pediatric coverage. In my state, that is primarily offered to most of the people in our state through a universal policy, meaning that they don't have to pay a separate premium or copayment. Dental diseases are chronic, progressive, and destructive over time. Yet too often, oral health care is overlooked or ignored. We have made great progress, but there are still millions of children in our country without dental care. We must continue to work to ensure that all Americans have access to both medical and dental care, as no citizen of our country should ever have to choose between going into debt and receiving proper health care. The health care system was not there for Ronald, but thanks to CHIP and the Affordable Care Act, it has the potential of helping his daughter stay healthy for years to come. Let us pledge to do more for our children, starting with the reauthorization of the Children's Health Insurance Program, CHIP, including the Guaranteed Pediatric Dental Benefit. With that, Mr. President, I would suggest the absence of a quorum.